Hey guys, welcome back to my kitchen table. I wanted to give a quick update on what I've been working on. I know I took a little bit of a break from social media in general and inadvertently from helping as well. So I apologize if you're sitting in my other folder. I took a look at it, but just with what's going on with my life right now and COVID and being a frontline healthcare worker and just trying to figure stuff out outside of the vestibular world. I just felt a little bit overwhelmed, so I apologize about that. I did want to talk about something that I've been thinking a lot about, and that's vestibular migraine and migraine-associated vertigo, and also, I guess, PPPD and chronic subjective dizziness. So if you've been suffering for longer than we all want to suffer for as short a period as we can, but if you've been suffering for 6 to 12 months and you've plateaued, this video is for you. So I over the years, and not recently, but over the years, have followed many people very closely in their journeys to vestibular recovery, and thank goodness most recover. But I have found that there are a few stragglers, and I know you'll know who you are, so I'm not going to mention any names, who have suffered and, listened to me when I said, you got to get your anxiety under control. You have to move more. You have to maintain optimal plasticity. They still haven't gotten there, and they get so frustrated. But what I have found is I've had a slew of people who in the beginning of our discussion and at length of discussion have discussed VNG results and symptoms and come to the conclusion through diagnosis through physicians and ENTs and everybody physio that this is a hypofunction issue. This is a vestibularitis. This is a labyrinthitis event. And, these are the steps you have to follow. You have to move calmly over time and desensitize yourself to the movement. So they've done that treatment. They're standing on a pillow with their eyes closed, hopping around in circles, going, "Why am I not there yet? Like, Sharon, I've done everything, that we can think of, the black belt VRT, and I'm still not there, and I'm frustrated." So they go on and they meet with Dr. Bay. And I find that those who I've talked to and spoken with who have met with Dr. Bay, he's apparently really great. I haven't spoken with him myself, but a lot of these people who we've been kind of treating, and I know I'm not a physician, so I don't actually treat, but I volunteer to help. So who have volunteered to help, they've done the movements, they've gotten their anxiety down, and they're still not there. And he goes, "We're going to put you on some migraine medication and migraine preventative." So things like Topamax and things like that. So I'm not sure even if these people really even have vestibular migraine. And I wanted to talk a little bit about the difference of VM and MAV later, but they seem to go on these medications and they not immediately, because the medication takes time to work, and I encourage you, if you do start a medication, to take your time with it, give it time. You might feel a little off, you're going to be stressed because you're going to be worried about how it affects your system, but give it the 6 weeks to 8 weeks that it needs to even start working, to start to plateau, for your body to adjust for the medication to work. They start to feel better. So I've seen enough of these patients that I felt obligated and, to act and to raise a suspicion that, I don't know all the answers. I'm not a physician. I'm just somebody who's witnessed a lot of recoveries and who has recovered myself. But I am starting to see a trend, and I thought it important to talk about, because I think, in my mind, I'm sure for years I've been kind of, you don't want to even go there, because if somebody has a hypofunction, they know that they can overcome it. If they have a vestibular migraine or an MAV that they've been diagnosed with, it's considered, and I don't know if this is just maybe it's a misconception, that it's a chronic issue, that it takes chronic management, that you're going to have it forever, because that, to somebody with a hypofunction, and I'm not sure how my vestibular migraine peeps feel about this, to think about this issue that we're having in the moment, which is so horrible and just awful and life-changing, as being a chronic issue, is like, that would be awful. Like, I can't even imagine. But I'm wondering in the back of my mind if maybe these migraine medications have some sort of unintended benefit to those of us without vestibular migraine or without MAV, who just have this failure to compensate. I don't know if it's that it decreases our, our sensitization, makes us more plastic. I don't know if it has this unintended effect of decreasing anxiety. I don't know if it's a placebo effect. I don't know what it is. Maybe if Dr. Bay gave me Smarties, I would be like, oh my God, I feel better because I know he's the one. He's like the guy, right? So if you're out there watching this, Dr. Bay, I apologize. I haven't spoken with you yet. I have all these doctors who I'd love to just kind of sit around and chat with, but I kind of pick and choose. I live on an island, so I have talked to some experts in my area, in the area. But yeah, I'd love to chat about it. But I do find that this is a trend that I'm seeing, and if you're on the pillow and you're hopping around in the darkness on one foot, doing, we talked about playing word games in your head and doing additions and that sort of thing to try to really force yourself out of a plateau, then maybe it is time to start thinking about this and not thinking about it as a chronic issue that you're going to need to address for the rest of your life and that you're never going to be able to get out, but maybe as a way out. Maybe it's like how they use aspirin. Aspirin was a pain medication and now it's used to treat people with at risk for heart attack and stroke, and even first trimester. I have like young patients in their 20s on baby aspirin to try to prevent miscarriage if they've had repeat miscarriage. So maybe this, maybe it's not a miracle drug, but maybe it might be another tool in our toolbox that we can use. I didn't get a chance to talk about the difference between migraine associated vertigo and VM, but basically it's that when I think about migraine associated vertigo, I think about my friends who have migraine, a long-standing history of migraine, and sometimes it makes them dizzy. And so that I would consider to be migraine driven. With vestibular migraine, I think about people like us who have either hypofunction or maybe they have migraine associated vertigo, that kind of it's the dizziness, it's the dysfunction that causes the migraine, and then that cycle repeats itself. And I think that, sometimes in my head I'm like, is vestibular migraine just sensitization in a different way? Instead of manifesting in dizziness, is the protectometer of our brain, is it a pain thing like they have with chronic pain? Do we get pain in our head because we're dizzy and because our brain is trying to get us to slow down because they're registering as a threat? So I consider migraine associated vertigo as migraine driven and vestibular migraine as vestibularly driven. So that's, I think, an important point to make. I don't know if we would treat them differently, but maybe we would look one as chronic and one as you treat it, you desensitize the system itself, and then your vestibular migraine goes away. Maybe those people with migraine associated vertigo constantly are having to keep their migraines under control because maybe that is a different beast than we have to worry about. So that's my 2 cents for today. I hope this helps someone. It's been crazy at work. Like I said, the ceiling literally fell in this weekend. So I didn't sleep much last night, but I'm off today and I'm thankful for that. We had a nice sunny weekend and finally the good weather's coming. So I hope to hear your thoughts about this. I'm sorry for neglecting everybody. It's been one hell of a year for, I think, everyone, but definitely as a frontline worker and having my husband be a frontline worker too, it's been one of my most challenging years, but still nothing compared to when I was dizzy. That's true. So always looking on the bright side. Anyway, you guys just keep moving, keep calm, and maybe talk to your doctor about the migraine aspect, or talk to each other and see what you think. Have a good day.